Welcome. This is a recorded information session for patients awaiting lumpectomies or segmental mastectomies at the Jewish General Hospital in Montreal, Quebec. It is presented by the breast cancer pivo nurses and occupational therapist at the Segal Cancer Centre, as well as the physiotherapist at Hope & Cope. This information should not be considered as medical advice. It is not to be used in place of a visit with a doctor, nurse, or other healthcare professional. If you have questions about your individual medical situation, please consult with your healthcare professional. This session will begin with a short presentation from the nurses, followed by the occupational therapist, and ending with the physiotherapist.
So I'm going to be reviewing the nursing considerations, which include surgery overview, going home after surgery. I'm going to speak about pain control, caring for your dressing, and things to monitor and look out for after your surgery. So the surgery that you're going to be having is a lumpectomy with a sentinel lymph node biopsy, plus or minus an axillary lymph node dissection. So how the surgery goes, you can see on the diagram there's an incision over the breast where the tumor is going to be removed with a margin of healthy tissue, and there'll also be an incision in your armpit, in your axilla, where they remove some lymph nodes, the lymph nodes that are closest to the breast cancer tumor. A lumpectomy surgery is done as an outpatient same-day surgery. So this means that you're going to be going home on the same day that you have the operation. The surgery itself usually takes about 45 minutes to 1 hour, but plan on being here all day. You're going to be staying in the recovery room after the surgery until you've recovered from anesthetic. You need to be steady on your feet and have to be able to urinate on your own. It's also important that your pain is well controlled before you're discharged home. And this can take a few hours, and it's also different for everybody. Please don't drive yourself home from your surgery. You're going to be very drowsy after being under general anesthetic. So it's important to have somebody be there who can drive you home. And if you don't have a family member who can pick you up, you could also make plans to take a taxi home. So ways that sometimes when a tumor is very small and it's difficult to, it's so small that it's difficult to palpate, one thing the surgeon does to locate the tumor is the morning of the surgery, there's a needle that's put into where the tumor is. It's usually done on the 10th floor in the breast center the morning of your surgery, and it's done under ultrasound guidance. So it's called a needle localization, and this is done so that it helps the surgeon, it guides them to where the area that needs to be removed is. There's different ways that the surgeon identifies where the sentinel lymph node is. The sentinel lymph node is the lymph node that the breast tumor drains into. So one way that they do this is they inject a blue dye into the tumor, and then the blue dye travels to the closest lymph node, and it becomes blue. So the surgeon's able to identify it during surgery to let him or her know which lymph nodes need to be removed. Another way that they identify the sentinel lymph node is by injecting a radioactive isotope into the tumor, and then same principle as the blue dye, the isotope travels to the lymph nodes that are closest to the breast tumor, and then during the surgery they can use a special device called a Geiger meter to determine which lymph nodes need to be removed. This operation is less painful than a mastectomy. Women often find that Tylenol extra strength is sufficient for pain relief, but your doctor might prescribe you a stronger pain medication before you leave the hospital. It's important to take these pain medications. It can help with your recuperation and your recovery. After this type of surgery, it could be normal to experience pain to your upper arm, your shoulder or back, or on this, or even like a burning sensation on the back of your upper arm. These can be normal types of pain that you experience after this type of surgery. If you have any questions about how to control your pain, or if your pain is not well controlled, you can call Kim or Andrea. Depending on your doctor, you're going to be told to remove your dressing 48 to 72 hours after surgery. It's important to remember not to get the dressing wet. As long as you have the dressing on, you should do a sponge bath or sit in the tub with water up to your waist and wash yourself that way. Once you do remove the dressing, it's important not to remove the steri strips. This is what steri strips look like. They're little pieces of surgical tape that are put over the incision to give it some extra support, and those don't need to be removed when you remove your dressing. They're waterproof and they will fall off by themselves in about 2 weeks. Depending on your surgeon, dissolvable stitches or surgical staples will be used to close the incision. If staples are used, there's going to be an arrangement that'll be made with your CLSC to remove the staples at a later date. And this arrangement is going to be made by the nurses in the post-op recovery room area the day that you have your surgery. This is what surgical staples look like. The redness that you see here is not an infection. When you have surgical staples in your skin can become irritated by them. And once the staples are removed, this redness usually goes away. You might have a drain in place after your surgery. It's called a Jackson-Pratt Drain. This would be if you had a lot of lymph nodes that were removed from your armpit to help drain the fluid of the lymphatic system where the surgery was done. The drains are usually left in place for 7 to 10 days after surgery, and they can be removed by either your surgeon or a CLSC nurse. You'll be asked to empty the drain 2 to 3 times each day. You can record the amount that is drained in 24 hours. Normally, the surgeons want the drain to be draining 30 milliliters or less in 24 hours for the drain to be removed. Make sure that you squeeze the bulb as close to the cap and close the cap on the drain after emptying it. This maintains suction to draw the fluid out. You can also shower with the drain in place after your dressing is removed. There are some things that can happen after breast surgery. So one of them is a hematoma. It's basically like a very large bruise, and a lot of women get concerned when they see this and think that it's an infection, but in fact this is a bruise, and it just takes time to reabsorb by itself. It's not dangerous. It just it looks scarier than it is. But if you do have one of these and it's really painful, or there's like a lot of pressure that's going onto your incision, feel free to call Kim or Andrea and we can take a look at it. Another thing that can happen after this type of surgery is called a seroma. And this is fluid lymphatic fluid that accumulates where the surgery was done, usually in the axilla, in the armpit. but it can also accumulate in the breast where the surgery is done there. It usually looks like a small ball underneath the incision, kind of like what you see here. And this will reabsorb by itself as well. Sometimes it can take weeks, sometimes months, depending on the volume, but it's not dangerous, and your body will reabsorb the fluid. And as I mentioned before, if it's causing a lot of pain or sensitivity, call Kim or Andrea. With the type of surgery that you're going to be having, there can be a lot of body image issues that come up afterwards, and maybe even intimacy with your partner. So this is just to let you know that we do have services at the Jewish General Hospital that can address these issues and support you through them. So if ever you need this type of support, don't hesitate to call Kim or Andrea. It's important to know the signs and symptoms of infection. So heat and redness to the site, increased pain, a discharge that's thick and looks like pus, or a fever that's 38 degrees or higher, can all be signs of an infection. If you already have the dressing on and you're not able to look at the incision itself, if you develop a fever that's 38 degrees or higher and you have chills and you really don't feel well, that could be a sign of an infection. Once the dressing is off, you can monitor it by looking at it. And if you experience any of these symptoms, call Kim or Andrea. If it happens during the weekend or during the night and you don't feel well, please go to the emergency room. This is an example of what an infection looks like. It's usually bright, angry red and hot to the touch. Lymphedema is something to be aware about. It's an accumulation of fluid that occurs when the body can't properly drain lymphatic fluid from an extremity or body part. This is usually an arm in the case of breast surgery, but it could also be chest or upper back. And people who are at risk have had axillary lymph nodes removed, which are the lymph nodes that are in your armpit. You're also at greater risk for developing lymphedema if you get radiotherapy to your armpit area. And it's a lifelong risk, so it can happen 5, 10, 15 years after your surgery as well. And people who only have 1 or 2 lymph nodes removed, it's more rare, but it's still possible to get lymphedema if you've only had a few lymph nodes removed. So it's good to be aware of this. Prevention is important. You need to protect the at-risk arm. So wear gloves when you're gardening or doing the dishes. You should keep the arm clean, dry, and well moisturized. No blood pressure or blood tests should be done on that arm. And avoid any type of trauma, so no nicks or cuts, and don't cut cuticles. If you go and have a manicure done, you can bring your own tools as well. If symptoms do develop, and women usually describe this as being, they feel a heaviness in their arm, they notice that their watch and their rings are no longer fitting, this could be a sign that it's starting to develop. So you could speak to your doctor and ask for a referral to a specialized physiotherapist who can help you manage this. And her name is Natasha Grant.
My name is Kyla Johnson, and I'm the Occupational Therapist here at the Segal Cancer Centre at the Jewish General Hospital in Montreal. Today I'm going to be giving you some pointers of things that you can do in preparation for your surgery, the day of, and how to resume your daily activities following your breast cancer surgery. As you're anticipating your breast cancer surgery, you can begin to prepare and freeze extra meals. Look around the house, and any large tasks that need to get done should be done in advance. In your kitchen, if there are objects that you use frequently that are stored above your head or below your waist, consider taking these objects and leaving them out on the counter for easy access. Make sure that you designate a driver home from your surgery, as well as arrange for any child or pet care that may be necessary. On the day of your surgery, consider wearing a button or a zip-up shirt to ease dressing following surgery. Make sure that you bring any medications that you may need for the full day, and always leave any valuables at home. Following your surgery, it's important that you continue to use the arm on the surgical side to do daily activities. Please continue to brush your teeth, wash your face, eat with the affected side. Things to avoid include lifting very heavy objects, like a bag of full groceries, or doing heavy housework, like vacuuming, cleaning the bathtub, mopping the floors. You may find that you're more comfortable to sleep on your back or the unaffected side for the first 2 weeks following your surgery. Bring extra pillows into your bed, and don't be afraid to use them as props to find an ideally comfortable position. Also in seated, you may find that by elevating the arm on the surgical side with the pillow is more comfortable. Getting out of bed can be best accomplished by rolling onto the unaffected side, dropping your feet off the bed, and using your unaffected arm to push up into a seated position. You can reverse this process for getting into bed. It's normal to feel tired after surgery. In order to best manage this fatigue, make sure that you prioritize the tasks that are most important to you. Take rest breaks between your activities, and don't be afraid to accept help from the people around you. Many women have concerns with body image before their surgery, wondering how their breast will look after. If you have these concerns and you're curious to know more, be sure to speak with your healthcare team, who would be happy to share information about body image, appearance, and sexuality. Remember, everyone's experience is different, and if you have specific questions, address them with your healthcare team. There are several community resources available for people whose lives have been touched by breast cancer. The Hope and Cope Wellness Centre, Can Support, the West Island Cancer Wellness Centre, Virage Quebec, and the Quebec Breast Cancer Foundation are excellent resources where you can find additional support in the community.
Hi, my name is Maurice. I'm a physiotherapist in oncology, and I'm going to be going through the rehab portion for after your lumpectomy. Now, the reason why exercises are going to be important, the first main objective is to regain your arm movement. So the side that you've had the surgery on, often the shoulder mobility may be affected. So the exercises I provide in this session will help ensure that your movement returns back to normal. I'm going to go through some scar tissue massages once the scar has been healed, and that will help with the elasticity of your skin. I'm going to discuss some possible side effects that can happen after a lumpectomy. So one example was mentioned earlier in terms of the lymphedema. However, I'm going to discuss possibly other side effects. And the final objective is to maintain or improve your posture, and this will be done using certain exercises. So some tips for exercising. One thing that is very important is to wear comfortable clothing. So for example, if you have an old cotton t-shirt lying around, those cotton t-shirts are going to be important to wear so that it allows your skin to breathe during the exercises. Also, while you're doing your exercises, you want to do them slowly. So the point is not to speed up anything, but to take your time. The exercises should not be painful, but you will feel a gentle stretch, and that is completely normal during your exercises. Now, there is a possibility, for whatever reason, if you wake up with a drain after your lumpectomy, there is only one restriction with shoulder movement, and that is while the drain is in place, you do not want to lift your arm up higher than shoulder height, so shoulder height forward, or shoulder height to the side. So in the image below, you can see that she's only lifting her arm up forward in front of her, and she's stopping at around 90 degrees. And this is because if you bring your arm up over 90 degrees while the drains are in place. As per the literature, this may increase the risk of developing lymphedema, so we want to minimize that risk, and we want the lymphatic system to drain out properly. So while the drain is in place, please do not lift your arm up higher than 90 degrees. So these are the exercises that I recommend to start after your surgery. Now, usually a lot of patients will feel comfortable to start them, 2-3 days after their surgery. So the first exercise is the stick or cane exercise. And what you want to do in order to do this exercise is you want to find a stick at home or a cane. So some patients have an old cane lying around. Or you can get a stick from your mop or your sweeper. You just remove the bottom and you have a nice long stick. So here what you want to do is you want to lie on your back, so either using a yoga mat or lying in your bed. You want to bend your knees to make sure that your back is in neutral, and you want to make sure that your feet are shoulder width apart, again to make sure that your back is nice and comfortable. And the first exercise, you're going to hold that stick nice and straight, so without bending your elbows, and slowly with your good arm, it's going to help you bring that stick slowly over your head until you can get all the way to the back, just like the second image there. So you won't get there after a week from your surgery, but what you're going to notice is that every day your movement will improve until eventually you can bring your arm completely above your head. So all these exercises, you want to be able to do 10 repetitions. You want to do 2 to 3 sets, so that's around 20 or 30 repetitions. And you want to aim to do this 2-3 times a day, and this is really just to start to encourage your shoulder to move slowly to help with your recovery. Now, the second image is, the second exercise is shown in the image here using the snow angel exercise. So what you're doing, again, you're lying on your back, your knees are bent, and your palms are facing up. So what you're doing is you're slowly gliding your arms by your side until eventually your arms glide and they're reached all the way up above your head. And again, for this particular exercise, you want to make sure that your elbow remains nice and straight and you go at your own pace. So slowly each day, you're going to notice that it can go a little bit higher and higher. In the third exercise, here you're going to do this one in standing, and you're going to use your cane to do this, or your stick. So what you're going to do, the arm that you're pushing away from your body is the arm that you've had the surgery on. So in this particular example, her left arm is the surgical side. And what you want to do is, using your good arm, you're going to push the arm away from your body. And slowly, you're going to notice that your arm can go a little bit higher each time until you can raise your arm completely straight over your head. Now, just to be mindful with this particular exercise, you want to make sure that your arm really stays parallel to your body, that your arm doesn't go a little bit forward or too far back, to ensure that the right muscles are being recruited for this exercise. So again, you want to aim to do 10 repetitions, 2-3 sets, 2-3 times a day. The next exercise, you're going to need either a towel or a scarf to do this exercise. The arm that is behind the back, so in this example it's her left arm, is the arm that you've had the surgery on. And the good arm is the one that's holding the towel above at the top. And what you're doing here is you're trying to improve the arm movement that's involved to bring your arm behind your back. So what you're doing with the right arm here is you're going to pull so that the left arm slowly comes a bit higher each time, until eventually you can bring your arm to the middle of your back. And you want to then slowly release that towel to bring it back all the way down. Again, you're going to try to aim for 10 repetitions, 2-3 sets, 2-3 times a day for this exercise. The next exercise is actually divided into 2 parts. So the first part is the 2 images that's shown together, and then the second exercise is the one shown on the right. So first exercise here, what you're doing is you're going to stand next to the wall. You're going to keep your arms nice and straight. And like a spider with your fingers, you're going to slowly crawl up the wall, keeping your arm and elbow nice and straight. And as you get higher and higher, you're going to just scooch slowly more and more towards the wall until your arm can go all the way up above your head. The second image, excuse me, is almost the exact same. So this time you're going to be facing the wall. You're going to keep your elbow nice and straight, your arm is straight, and again with your fingertips, you're going to crawl slowly until your arm can get all the way up and it's nice and straight against the wall. And you want to aim again for 10 repetitions, 2 to 3 sets, 2-3 times a day. Finally, the last exercise is in fact a gentle strengthening exercise, while the rest of the exercises I've explained are more exercises for range of motion. And what you're doing here is you're going to stand up nice and tall. You're going to keep your arms by your side at 90 degrees, just like the first image. And 2 parts to this exercise. First, you're going to bring your shoulders nice and back. And second, you want to try to get those elbows to kiss. So they won't ever touch, but what you're trying to do here is you're trying to get those shoulder blades to squeeze in together. And you want to hold that squeeze for a good 3 to 5 seconds and then slowly release. And so this movement essentially is strengthening all the upper back muscles, which tend to get a little bit weak after surgery. And this is important to maintain a good posture after your procedure. For the scar massage, what you want to do is, the scar massage is really important to allow that improvement in the elasticity and decreased tightness of the scar. And you only do this 3 to 4 weeks after your scar is completely closed, so that there's no risk of infection. And the best time to do this is in fact after your shower, because the pores of your skin are still open, so it can absorb the oil or the cream that you're using. So we encourage patients to use like a neutral type of cream, like an Aveeno, or any form of natural oils. And you want to apply that cream or oil over the scar. And there's 2 techniques to do this. Either a 2-finger technique, so just like the first image, using 2 fingers, you want to slowly make circles over the scar. And you want to make sure that you make those circles 2-3 centimeters above and 2-3 centimeters below that scar, to really make sure that all that scar tissue there has been massaged. The second technique is the image to the right, and that is the same concept, except with 2 fingers you're going to lift up the skin gently and you're going to do circular motion over that scar, again ensuring that you get 2-3 centimeters above and below the scar. And again, this is another type of massage that will help improve that elasticity of the scar itself. So another possible surgical side effect that we do see after a lumpectomy procedure is something called an axillary web syndrome. Often patients will call it a cord or cording. And so this is a cord that, just like a guitar string cord, it develops under the armpit or the axilla. Sometimes it radiates into the upper arm. Sometimes it goes all the way into the elbow, just like you can see in the first image. Sometimes it goes all the way into the wrist or even the thumb. And so what happens with this cord, it can cause a lot of tightness or pain as you're doing particular movements. So if you do feel this cording sensation, please contact your physiotherapist so that she or he can guide you slowly in terms of the proper management for the cord. Now, just to summarize, 6 weeks after your surgery, if you can't do these movements, please contact a physiotherapist. So the first movement is bringing your arms by your side, just like the first image, so that your arms can go all the way up above your head. The second image is the ability to bring your hand behind your back, so putting on your bra or scratching your back. The third image is being able to lift your arms in front of you so that they come all the way behind, just like the third image. The fourth and fifth are really just bending your arms at 90 degrees, being able to turn them in and turn them out. And the final image is being able to bring your arm behind your back and lifting it off your bum. So just in terms of the technical terms, you want to be able to abduct your arm in the first position, the hand behind the back in the second. You want to be able to do flexion of your shoulder, internal rotation, external rotation, and extension of your shoulder 6 weeks after your surgery. So if you are not able to do all these movements, please contact your physiotherapist. Some of the services that we do offer you can find at the Hope and Cope Centre, and that's the wellness center that's close to the Jewish General Hospital. And there's a lot of activities that we do provide, particularly for breast patients, and it's really to encourage them to remain active. So there is a physiotherapist and there is a exercise therapist that you can speak with, and they can help you get your activity level back to normal after your surgery and ensure that you are safe to do so. So for more information, you can check out the website at hopeandcope.com. And finally, this is just a summary slide to go through all our contacts. So the breast pivot nurses contacts the occupational therapist, and the physiotherapist is Nadia, and she is located at the Wellness Center. And if you have any questions or concerns, you can contact her at the extension below.